Thanks for tapping into another episode of Untapped Keg podcast, where we look at different perspectives of sobriety and mental health so that you can take something, implement it into your own life. Here, we believe there's only one right way to sobriety. That's the way that works for you. I'm RJ Zimmerman, and I am extremely excited to have clinical forensic psychologist Gabrielle Klepfisz with me today. How are you doing today, Gabrielle?
I'm well, thank you. How are you?
I'm good. I always enjoy seeing people's reactions. I made sure I watch to see what you when I get to there's only one right way to sobriety. And so many people are like, where's he going with this? Because most people know, like, I really don't believe there's one right way. And when I say the way that works for you, like all of a sudden just the tension leaves their face. And it's just I like to see
Absolutely.
that. So Gabrielle, for those who are just coming in contact with you for the first time, could you let us know, a little bit about you?
Absolutely. So I am a clinical and forensic psychologist based in Melbourne, Australia. And I am in private practice a couple of days a week, and I work in the forensic system the other days. And I basically came to work in the substance use space after a placement I did during my training. I absolutely loved it. And I realized that there were so many misconceptions around substance use, so much stigma. And really, for me, it was about learning everything that was under the substance use. It was so important to understand to help the person. And it just kind of developed into this passion of mine of working in this space. So that's kind of what I'm doing now. I see all various presentations in my private practice, but I really specialize and focus on people who are struggling with addictive behaviors and substances.
And when we were talking, kind of in the lead up to recording this episode, you had mentioned that your modality that you specialize in. And so, could you talk about that a little bit and give people a little bit of a background? Because I think it's one that we even talked about. It's not as well known, but it's really interesting too.
Yeah, so I've really been diving into schema therapy for substance use, and schema therapy is a really amazing model that doesn't just look at the symptoms, it looks at the underlying experiences that have shaped the person and led to the development of what's called schemas. So schemas are kind of like how we view ourselves, other people, and the world around us. And it's more than just a belief. It's kind of like, it's beliefs, it's feelings, it's memories, it's sensations all tied into one. And they're kind of like emotional wounds that can get triggered. We all have schemas, but we all have different schemas based on our experiences. So it looks at how the development of these schemas then lead to ways of coping when they're triggered. And what I love about this approach is that substance use is seen as an understandable coping mechanism that at some point in time did help the person, but it's no longer serving them. So it's really compassionate and non-judgmental and really works with the person and where they're at.
And that's what I love about it, because Laura McCowan talks about, and ever since I've heard this from a client, like, it just blew my mind. And you talking about schema therapy just really gives it that grounded, in science kind of a thing, but it's ritualized comfort seeking, and just how approachable that is. I used to really call it escapism, because sometimes that's what it is, right? But that ritualized comfort seeking, and like you talked about how at the start it worked for you, but now it's no longer working. And so when you develop that understanding and people can kind of look at it from that perspective, now all of a sudden they're not so hard on themselves, like, why am I broken? Why is this me? Now it's like, oh, that's just something that I used to do and it worked, but now it just doesn't. That makes sense. There's a lot of things in life that happens with.
Yeah. And as you just said, people are so hard on themselves, and that's part of the schema model as well. So with addiction, there is very often, if not always, a really strong inner critic part. And that critic really perpetuates the cycle of substance use. So it elicits, all those really uncomfortable feelings, shame and guilt. And that's really hard to sit with as a human. And that's more likely to make the person want to go and use so they don't have to sit with that discomfort. So it's this cycle of substance use, the critic, the vulnerability, the shame, the guilt, and all going through that cyclical pattern.
And that it just makes so much sense to, like, being a alcohol-free life coach and really working with a lot of people in this area too, that and having experience that cycle that happens, right, that really brings about. And once you start to not even necessarily break the cycle, but you just enter it with that different viewpoint, the way that people go through that, they're just like, that's when it starts to unravel. And it's like, you're not just stopping that cycle because it's so difficult to do. You're more just, like I said, that different viewpoint that now you can see where it's going, and it starts to really unravel. And that's the that's almost that entry point, that now all of a sudden, oh, now we can start to actually work with what you were talking about earlier, that root, where now we can look at what's underneath there and start to address really what is causing what you're looking for and what's really causing that cycle in the first place, and start to deal with that.
Yeah. And I think that's why it's so rewarding, because it's not just symptom management. It's not just putting a band-aid over what is really a very complex and misunderstood problem. It's looking at the whole person and their whole experience. This is one part of you. This isn't all of you. And I can't get enough of it. I just think it's so interesting, and no two people are the same. And we just need to break down some of those misconceptions out there.
Yes, like that whole approaching it as the whole person rather than these boxes that you check. Okay, so now you check this box, so go to this box. It's like, okay, but what's the context? What is around there? Because this isn't all happening in a vacuum. There's so many different things that lead to it. And so having, the opportunity to be able to work with people and break those things down, it goes to um such a long way to actually be able to provide those tools as well, and not just, oh, just don't drink again and everything's going to be great.
As if that would work.
Right.
And that's why I get so frustrated as well with, like, just, those, I don't know, resources or accounts or things that are just spurting out all the negative impacts of substance use. Like, people know the negative impacts of substance use, and it doesn't just need to be drilled into them over and over and over again. Obviously there's a place for speaking about the risks, but just telling people about the risks and telling them off or making them feel ashamed isn't going to create change.
Mm. It turns out that when you pile shame on top of a pile of shame, that, yeah, it really doesn't do much to change the dynamic of everything. And I like to tell people too, I stopped drinking, but I didn't look at any of the reasons. And it wasn't until, my ex-wife came to me and asked for a divorce that it was like, oh, there are things that I need to dig at underneath here, because the not drinking didn't just take away all of my problems. It just took the blanket and kind of threw it to the side. And now, oh, hey, you got all this stuff. Do you want to look at it? No, I'm still going to stare over in this direction and just avoid that. That's okay.
And unfortunately, the reality is when you take away the substance, at first it might feel like there are more problems, because for the first
Yes.
time, you have to be willing to kind of sit in that discomfort without escaping or without numbing or without using the substance to provide that comfort. And
Mm.
that needs to be talked about, because if people are just looking at these sobriety motivation accounts and they're, painting it as this glorious thing that, suddenly everything was amazing and life was wonderful, like, that's great and it's motivating. But what about the person that doesn't feel that way? And they're not prepared for all the stuff that's going to come up when they stop drinking or using drugs. So I feel like both sides need to really be spoken about. Like, it's going to be hard, but it's going to be worth it.
And that's really what it's all about. And that's it, man. Like there's so many things too that are like bringing up these personal stories that I have too, and how, I went through most of my life just disconnected from myself. And, just quitting drinking and sobriety didn't bring me back into connection with myself. It actually highlighted that disconnection more. I just didn't realize it until I started to connect with myself and realizing just how much further away from myself I had gotten after I had stopped drinking. And that is absolutely, a trap that so many people can fall into. And especially like you're talking about the first, a lot of people talk about that pink cloud and how it happens in the first month, but for others, it may not happen ever. I don't ever remember having a pink cloud, to be honest. Um,
Mm.
where it was just like this moment. For those who don't know, like the pink cloud is like when everything like gets into, sharper focus and you start appreciating life more, and there's just so much going on. And because of how the life unfolded after I had stopped drinking, there was just so much going on. I honestly do not remember ever have experiencing that pink cloud. But as I see people experience it, I love it for them. But it definitely is not there for everyone. And so if you're not someone who feels that, and you're not a stubborn asshole like I was, that was like, this is just my life now, I'm just not gonna drink, like that, that can be something that is really, it just makes you defeated, and it's tough to work through. And so you just normalizing that sometimes, yeah, it takes a little bit to get through, but as you find these things that you enjoy in life and you start to connect with yourself, now your life is something that you want to live and you don't want to escape from.
Mm. And there may still be moments that you want to escape. I think the urge to
Yes.
escape
Yes.
is so human. It's so normal. We all do it on a day-to-day basis. Like, binge watching Netflix, scrolling on your phone for hours, shopping. Like, we all do it, but
Hmm.
it's not going to be the go-to anymore. And not with the same negative consequences to, relationships or your health or your finances and all of those things.
Yes, absolutely. And I think that's a really great thing to point out as well, is um, that it is okay to escape. That's part of like the coping, right? That's where those coping skills can kind of get out of out of whack and become something that starts to harm you. And that's where you were saying, it at one point it was okay and it was good, but now it's, getting in the way, and that could go to some other things. But it doesn't necessarily have to, as you start to learn that. And when you really go through and you look at your life from the perspective of just trying to understand yourself and understand what's
Yeah.
going on.
Yeah, absolutely. And it just, I guess, with time comes with more of that psychological flexibility. So you can kind of take a step back and observe what's happening in the moment and not get as attached to it. And then, there may be times where you choose to switch off and escape, but you're doing it with the awareness that you're doing it, and it's not just that autopilot.
Can you talk a little bit about, because I really love that word and I've seen it used more and I love it, the psychological flexibility, and just how
Yeah.
that can ha- be such a major benefit for you as you move through life, whether, it's alcohol that you're trying to stop or something else.
So I guess psychological flexibility, I mean, it's talked about a lot in acceptance and commitment therapy, ACT. But it's really about, you know, developing a different relationship with your thoughts and your feelings, and being able to be more fluid in the way you respond to things. So very often when we are struggling, it's because we are getting hooked into thoughts and feelings. We are attaching to them, we're over identifying with them, and we're struggling with them. And that might be because we're trying to resist things, we're trying to avoid things. Um, and what we want to do is we want to have more flexibility in how we approach our internal experience. And rather than being in our thoughts, we want to be able to observe our thoughts and instead of saying I am anxious, it's I'm noticing that I'm feeling anxious. So it's really taking a step back from the feeling. I'm not the feeling. I'm noticing, there's a part of me noticing that I am feeling this emotion. And therefore I can choose what I'm going to do in response to it. I can choose if I'm going to use alcohol in order to numb this. I can choose if I'm going to sit with this. I can choose if I need to call a friend and seek support. So there's choice when you can observe and not attach to that experience. And it's a lot more flexible. I don't know if I explained that in the best way. I don't have my ACT textbook with me, so it's not the description they would give, but that's kind of how I see it.
Yeah, and it's a really usable way to look at it as well, right? Just being able to look at things in a way that you can adapt to it and not be tied to it, and just the difference that can come from that. And being able to create these areas of yourself that you can start to go through life with multiple different tools at your fingertips. And that's where that knowledge gaining can really come in, whether it's reading books, listening to podcasts, doing things different in your life that can give you some, not just understanding of yourself, but maybe a deeper understanding of life in general, because that's okay. And being able to understand how it can cross into different aspects as well is something that's really important. Um, when it comes to working on that holistic side with people and looking at deeper than just the substance, when people come in, what do you notice um, what do you notice happens when people all of a sudden look and they see, oh, you mean there's something deeper than just this substance?
I think people know it generally.
Hmm.
They might not understand it, but my experience is they know there's something more there, and they maybe just require that support to help put it all together into a picture that makes sense. And I always say, like, people don't choose to have a substance use disorder or addiction. I mean, addiction's not a clinical term, but I'll use it for the ease of saying it. But nobody chooses it. It's because there is something underlying it, and very often that's trauma. So I feel like people know that there's something there, and maybe they just need help to organize it. And I always kind of approach it as my clients are the experts on their lives. I'm not the expert on them. I'm just there to support them to make sense of all of this and to maybe help with some of the strategies. But really, they're the ones to tell me about themselves. And then I'm just there to help kind of organize it. But I think they do find the schema approach really compassionate, because I'm not sitting there telling them off. I'm sitting there saying, this makes so much sense.
Yeah. And just when somebody is able to actually talk about something that they feel, and they're like, I know that this isn't something that I should be doing, but I'm broken and I keep choosing this one thing. And then all of a sudden somebody's like, well, you're not broken. It's completely understandable why you're choosing that. And they're like, wait, what? I'm not broken? What do you mean? And just how different that can be. And you're talking about some of the other strategies that might be able to come up. And are there some that you notice? Everybody's unique, so they're all going to work a little bit differently, but are there some strategies that give people a uh, more of a chance when it comes to, let's say, putting time between the thought of I really want to drink right now to actually reaching and grabbing that drink and having it?
I think that with schema, it's really about identifying these different parts. And so a lot of work in the initial phases is getting to understand the different parts. So, you know, the inner critic part, and with the substance use, very often that's what's called the detached protector. So it's a protective part that's helping you detach. So identifying when that's been triggered. How do I know that's been triggered? What does that feel like in my body? What's my experience like? And so really developing an awareness of what that part feels, thinks, looks like. And then eventually, hopefully, the person can notice when a schema has been triggered, notice that they're starting to go into that detached protector because it has that way of thinking and feeling and doing, and then can try and use what we call the healthy adult part of themselves to, you know, draw upon something else to help them in that moment, whether it's, you know, taking a minute to reflect on their reasons for not wanting to pick up that drink, whether it's, you know, making space for whatever feeling was there, whatever the skill is. And that's part of the therapy to build up those coping skills. So you've got all of that. It is a complex therapy that I'm trying to kind of put into digestible terms.
Mhm.
But when you can notice those triggers and how you're responding to it in the moment, I think that's really powerful.
And that's something that I think you're doing a really great job of breaking this down into digestible terms, because um, you could tell that there is that deeper and the more context into a lot of this. So I appreciate you doing that. And then the way that once you can name these different parts, and you're just like, oh, hey there, Lloyd. Oh, hey, Jerry. I appreciate you coming through. That, and just being able to have that can really set you up in a place for success, and just looking at things from a perspective that is just a breath of fresh air, instead of a lot of those the ways that we look at it, like it's just this one thing that we got to focus on and look at. And the thing is external from ourselves. And when we put so much emphasis on that external thing, we really set ourselves up for failure, instead of looking internally and how we can process things and use them in a way that it's not just understandable, but we can use it to set ourselves up for success, instead of setting ourselves up for failure and focusing on that external.
Yeah. And I think also, because it's looking at these parts, the detached protector right now might be substance use, but it also sets the person up for, once they put down the substance, if that becomes food instead, or if that becomes Netflix, or it becomes scrolling on your phone, it's the same part. It's just a different thing. So you've still got the skills to deal with the part that wants to detach,
Mm-hmm.
no matter if it's substances, no matter if it's food, no matter if it's technology.
And that's something that you bringing that up, like that was work for me for quite a while. Was I put so much time and effort into work, and I didn't even realize that I was doing it. And so once you can kind of get and understand more of what's going on, it gives you more of that opportunity to be able to take and use in this other area. um when it comes to the schema therapy, um it really it's really similar to, and you and I talked about this, but and it sounds similar to like IFS, and how there's differences there. And what are the differences between like schema and IFS?
So they're both parts models. So
Hmm.
at their core, they both see these, substance use as a part of the person. Schema talks about maladaptive coping modes, whereas IFS talks about these protective parts, and they kind of categorize protective parts into two, types. They've got the firefighters and they've got the managers. Which I quite like that distinction as well, because the managers is kind of like you said, it's like throwing yourself into work. You can see how if you visualized what that part would look like. It might be you in a suit or something, or, it's very much a much more successful or, acceptable way of
Yes.
doing things by society's standards. But it's still the same thing. It's still trying to protect you from, in IFS, the exiles. In schema therapy, it's the vulnerable child modes, or the child modes. It's still trying to protect you from feeling all that stuff. It's just doing it in a way that's much more getting on with normal daily life, as opposed to the firefighters, which are much more reactive. They're there to put out fires. So if there's like an emotional crisis, they're there to put it out as quickly as possible. So whether that's substance use, self-harm, something that just needs to be done very quickly in the moment to put out that fire. That's how IFS conceptualizes it. So again, it's very similar, but they just kind of have some slight differences. IFS talks about the self, which is kind of that part of you that we all have, we're all born with. It's kind of centered, it's grounded, it's compassionate, it's curious. They talk about the 8 C's that kind of characterize the self. Schema therapy is more about the healthy adult part. Doesn't quite have that same spiritual element inherent to it, but it could. Like, if for someone faith and spirituality important, that could very well be a part of the healthy adult. So they are very similar. They do have their differences. But I love that they're both parts work, they're both parts models, and they're both compassionate approaches.
And that's what's so cool, like really cool about this, right? And I was about to not use that word, but it really is to me, where it's these newer ways of being able to think about psychology from a perspective that we don't really look at when you're looking at mainstream psychology, even though like IFS is really having kind of like a spotlight shown on it, shined on it. I don't, yeah. There's a spotlight on it. That's what we're gonna say, right? And it's really neat to see. But the schema therapy, like as you talk about it and you describe it, it's something that is even, seeing the use for substance use and how the compassionate side really is there, like having both of these available to different, hopefully as they become more practiced by therapists out there, right? People who are going through substance use, they'll be able to find somebody who uses these so that they can have that compassionate approach rather than those really hard line, do it this way, things are gonna work out. And the stuff that honestly, we look at the numbers and we see it, and yes, it works for some people, and that's so fantastic, but just how well does it really work? And that's something that i I try to shy away from talking about because it works for so many people, and I understand that. But just at my core, it's like, okay, there's better ways of doing this. Why are we not exploring it more? And these therapies are coming, coming through and showing that, oh yeah, there is some of this that is, it's available and it's more effective. Might take a little bit longer than just, oh hey, quit, stop drinking, right? It's more like, oh hey, let's look at this and let's figure out what's going on. And you can stop drinking in there too while you're doing this, don't get me wrong, but at the same time, it's like, it's that long-term investment that's happening over like the short term. You see it and you're good and you think you're good, and now all of a sudden you're put in a situation and you're triggered, and it's just like you don't really know how to work through it, or you're just a failure. It just, oh, did it again. I guess I'm just completely broken. And that just, it just gives me hope, and it's just something that I love to see. And that's, yes, that's really where I like to see things going.
Yeah, and that's something I speak about with clients from the get-go. that we need to talk about relapse prevention. And it's not because I don't have faith in you that you can do this, but the way, and I say this metaphor, the way I see it is like having a fire hydrant in the house. You're not expecting there's going to be a fire, but if there's a fire, you're prepared for it. And that's what relapse prevention is. I'm not expecting you to relapse, but I know, and the research says that relapse is a very common part of substance use. So let's be prepared. And if it happens, you just know that that is normal, that it's a normal part of the change process. And any behavioral change is difficult. Like, think about how you try and make changes to your diet, to the gym, like an exercise. Like, how many times does it take to like do that thing? And they're kind of smaller things in comparison very often. So I think having that conversation from the get-go really normalizes it and says, firstly, there's a difference between a lapse and a relapse. And part of what's going to be that difference is how you speak to yourself. That I think is so big to talk about from the get-go.
Yeah. And that's so with this snake in mind, with that I'm certified through and I do a lot of coaching through, we call it data points. Like, okay, this is probably going to happen. And guess what? It's okay because you're going to be collecting data. You're going to be looking at what was happening before. What did you actually feel during it? Did you actually get what you were looking for? What feeling was it you were looking for? All of that. And just the information that you can gather. Now you're looking at it from a perspective of, okay, what information did I gather rather than I'm just a complete failure. I got to go back to, erase everything that I knew before because it didn't work. And it's like, well, how do you know it didn't work? It's just not there for long enough to be able to be allowed to. And so as you talk about that and that self-talk, you change how you look at it from a perspective of you're, not failing, but oh, this is actually something that you're using. So it gives them a little bit more of that success. And what are some of the ways that, you talk to them about their self-talk?
So firstly, I think there's this very common cognitive distortion with substance use. You've probably heard of it, called the abstinence violation effect. But if you haven't, it's basically when you slip up, that is when you're saying, well, I've slipped up, I might as well give up. Fuck it, that's it, I'm done. And
I
how
never
common is
heard the
that?
name of it, but yeah, I've heard of that all the time. Yeah,
Yeah.
absolutely.
And so I talked to clients about that. I said, that will happen most likely if you slip up. But if you buy into it, that's going to be the difference between the lapse and the relapse. Because if you're saying, I might as well give up, I'm never going to change, this is just who I am, of course you're going to keep using. But if you say, you know what, I spoke about this with Gabby, we spoke about how this is really normal. Today is just a slip up. It's something that I can learn from and understand what triggered me. What can I do differently next time? And I can start fresh. It's just a day. And that's a much more self-compassionate approach. And it's going to mean the person is more likely to just let it be, learn from it, and get back to what they were doing beforehand. And, all respect to 12-step programs. I don't follow that model, but I think they have their place, and I think they can be absolutely, the greatest model for some people. But the thing that I always also speak to clients about is that counting of days and how that might not be helpful for you, because, in a 12-step model, you slip up, you go back to day one. And if that were me, I would just feel so defeated. Like, if you have any kind of perfectionistic, unrelenting standards under there, the
Yeah.
thought of going back to day one, if you're on, especially if you've got, your numbers up really high, that would be so defeating. I would just beat myself up. So I say, if counting works for you, great. But this is where I see the pitfall, and just be mindful that if you slip up, you are not back at day one, because you have all this stuff that you've done and you've learned in between, and you don't just lose that if you slip up, you're adding to it. So I really want to communicate that message to everyone from the get-go.
And that's so important. And that's something that when people start to realize and they notice, oh, I didn't lose all of that knowledge that I gained. And then again, with like the data point or looking at the lapse and the relapse, it's like, oh, I gained some knowledge about this trigger that's there. So now I know it's there, and guess what? I can work with, Gabby on some uh techniques and tools that I can use to really get through this trigger, notice when it's coming, and take preemptive action, and not just wait for it to get to the point where it's kind of breaking. But one thing that I notice for people, especially with that perfectionistic mindset, because someone who had that, still has it from time to time,
Yeah.
being me, is the percentages can help for people who enjoy seeing their progress, right? And like, I mean, so many people need to see that progress. But if you look at the percentage that you're drinking for, let's even say days before, but even like the amount, and you start to look like a month later, oh, how much less have you drank? Like, I used to drink, 6 drinks a night. Now I'm drinking two. Well, that's some
Yeah.
hell of some great progress, right? And then, month two of working with somebody, oh, now I'm having 3 alcohol-free nights a week. Like, what? Like, holy crap. And yeah, you're not stringing together all these consecutive days yet, but you're making such amazing progress. And then you start looking at, oh, 50% of this month I didn't drink. Oh, 70% of this month I didn't drink. And just how much that can start to move you forward in a way that now at 70%, well, it sure seems a lot more attainable to get to that 100% if that's what you're looking for. And
Yeah.
just how that counting style can help those people that it would benefit them to count. However, counting days, it really is one of those double-edged swords that
Mm.
it is good to urge people, like, if it works for you, great, but just know you don't have to,
Yeah.
and that there's nothing wrong with not doing that.
Yeah, I love what you said about like the percentages, because there are so many different markers of progress. Like it could
Yes.
be the amount you drink, it could be the number of alcohol-free days, it could be the money you're saving, it could
Mm.
be, how you're feeling, your mood. Like there's not just one way of tracking progress, and that's going to be different. It also depends on your values. Not everybody wants to achieve abstinence, and that's okay. And I'm going to work with where my client is at. So if they want to keep using, okay, so let's work on harm reduction and doing it safely. And then if or when you're ready to stop, I'm here and you haven't been shamed and you're willing to come and talk to me, because I'm not going to be telling you off. And I'm not going to be just telling you you need to stop, even though, the person probably knows they need to stop. I don't need to go drilling that into them. I'm not a parent. I'm here to support, and I'll work with my clients where they're at.
So what you're saying is you're a safe space for people.
I hope so. Yeah. I mean, that's what I want to communicate.
Right. And I think that something that I've noticed with the groups that, like, I work with, is oftentimes they hear that safe space and they're just like, what is that? Because they've never experienced it before. And then all of a sudden they experience it from somebody that they look at as an authority figure. And it's like, oh, this is like what a safe space is. It's and it's not a space that you can just go and mess up and be like, oh, it's okay because this is it. It's like you're going to be challenged, but you're not going to be challenged like put down to be challenged.
Yeah.
It's like, okay, you want to do this. So what can we do to move in that direction? Is it okay that it happened? Yes, it is. Are there things that we can laugh about in there too? Yeah. But also if we got to get serious and talk about how we can, move forward, and that was a mistake. That wasn't just a funny haha accident. Like, it was a mistake. But guess what? We all make mistakes and that's okay. And so when people actually get to experience that safe space for the first time, it's something that it's that just the amount of eye-openingness that all of a sudden the next week they just come with a different level of vulnerability because they opened up a little bit and they didn't get told that they were too much, or they didn't get told that they were not valid. It's like, wow, wow, that is, yeah, that is different. And so I just wanted to point out to people, like, that's what a safe space is, because I think a lot of people still don't necessarily know exactly what that means.
And the research, at least in terms of psychology, shows that the most important element to treatment success is that relationship between you and your therapist. And to me, if it's not a safe space, that relationship is not going to be solid, because nobody is going to feel like they can be 100% honest if they think they're going to be shamed about what they're doing.
Yes.
So that safe space to me is like an absolute essential ingredient for this kind of work. Less important are the specific techniques. Like, yes, they're important and they're useful, but that the research says that relationship is the most important ingredient.
What has helped you to create that safe space for people that they can show up and be their 100% selves with you?
I think for me, it's about how I hold myself. I don't want to, nor do I try to come across as the expert. And I try and say to people in the first session, like, I'm human. I might, make a mistake. I might say something that unintentionally upset you, but I want you to feel free to let me know if that's the case. This is your space, and I want you to get the most out of it as possible. So if something's not working for you, let me know, and then we can shift approach. I don't want you to sit here and feel like, oh, I can't say something, but I'm not really finding this very useful, because that's not going to be helpful to you. And I also try and bring my own humanness into the session. Like that, in the past, psychologists were blank slates, and I think that's changing. With social media, you can see people are starting to show their own personality. That doesn't mean blurring boundaries. It's still very important to have professional boundaries, but showing a bit of my personality in session and who I am, and not just being this kind of expert that has all this theory and knowledge and is doing something to you rather than being with you. So I guess I hope that is how people feel safe, because they are getting the real me, of course, in a boundaried professional way, but they're not just getting this wall.
And that's something that is, yeah, so incredibly helpful in establishing that, is not saying you're human, like you're not an expert. And a little story that I have about therapists, and I don't know, just how I was showing up and kind of like my journey is, I went and saw a therapist there was the therapist that I connected with the most. But for the first 2 months, every session, so 8 sessions, he kept calling me AJ instead of RJ. And I did not correct him for 8 sessions because I was like, oh, it's okay. It's, I know that he really does care about me. And even though he's calling me AJ every single time, like, I know the penmanship was probably not great. And it looked like the R looked like an A. So and then finally I was just like, all right, I have to tell you this, and it's not your fault, because I should have said it right away. But I was like, I'm at the point where I think I'm okay with not being the people pleaser anymore. And he felt so bad. He's like, you can talk to me about that stuff. I'm like, I do now, but I didn't before, and it's not your fault that I didn't. I just wasn't in a place to be able to.
I love that. I think it's so real. And if I was the client, I probably would have done the same thing. My neighbor the other day called me Libby, and I didn't correct him. So I think that's so real. But like, I guess, what I will say is that if you are working with someone, make sure you feel safe and make sure you feel like there is a connection, because that is going to be, I think, the most helpful thing, so that you can be vulnerable and honest and, really get the most out of those sessions.
And know that you don't have to be perfect, because they aren't either, right?
No, oh, there's no such thing.
Yeah, right. Exactly.
There is no such thing.
Oh, well, Libby, we're at that. I'm sorry. I couldn't help myself.
That was good. That was quick.
Oh, Gabby, this has been such an awesome episode. I know they're really gonna get a lot of this episode. If they want to be able to follow you and keep up with you and what's going on, how can they best do that?
So I've started a professional Instagram account. I am quite new to the Instagram space, but people are welcome to follow along. It's at Dr. G.
And people, seriously, I say this all the time, but for real, like every single thing that Gabby posts, I'm like, holy crap, profound. Holy crap, profound. Like it's just the things that you drop are just so in line with how I view the world and life and the mental health space, that it's really fantastic. So go and give Gabby a follow. And Gabby, if there's one thing that you could leave the people with from this episode, what would you want them to?
I think, really understanding that, it makes sense. It makes sense why you are or have been using substances in this way, and trying as best you can to notice that inner critic, find that self-compassion. Self-compassion doesn't mean you have to like what you've done. It doesn't mean you have to even like yourself, although hopefully over time you can come to like yourself more. It's just about speaking to yourself the way you would speak to someone you love, not beating yourself up for being human, recognizing that we all make mistakes. And, you know, this is something that makes sense in the context of your history, but it doesn't mean, even if you keep slipping up, it doesn't mean you can't make change. It doesn't mean you're not worthy. I think it's so important to just try and tap into that self-compassion, because self-criticism, I mean, I'm assuming most people are very familiar with self-criticism. If it was going to work, it would have worked. I think it's time to kind of really start tapping into the self-compassion.
And yeah, that's such an amazing way to put it too, where it doesn't have to be that you necessarily like yourself or love right now. It just
Hmm.
gives you the space to be human. And
Yeah.
oh, it's really beautiful. So thank you so much, Gabby, for
Thank you for
joining
having
us.
me.
This was such a great conversation. And I think it's really going to benefit a lot of people. So if you're listening and you know somebody who would benefit from this episode, please share it. Please, hit that subscribe button and leave us a review. Let me know how I'm doing, whether it's, 1 star, no star, 5 star. I appreciate the feedback. And even if it's just, hey, you suck, well, at least you gave me a little bit of time to let me know. So I appreciate that. And everyone, let's try to be better tomorrow than we were today, because if we don't make it, we tried. Have a great week, everyone. I love you.